Liz asks, what is the difference between an eCQM and a MIPS CQM?
Well, Liz, I'm glad you asked. It fits right into the last two questions. eCQMs are collected from EHR data and calculated using ONC certified technology. MIPS CQMs are collected from any valid data source, including EHR data, and are calculated by a qualified registry. Both are valid for the three measures required by the APM performance pathway, the APP. eCQMs tend to be exclusive to the EHR, exclusive of a certain documentation style, um, uh, even exclusive to the specific instance of an EMR implementation. MIPS CQMs tend to be inclusive. They can cast a broader net to accommodate multiple different documentation styles in the EHR. They can pull data from multiple EHRs or multiple other alternative data sources like tumor registries, diabetic registries, anything that exists in your system, and can even include manually generated, manually abstracted data. There are 48 eCQMs maintained for the quality program compared to 174 for MIPS CQMs. 26 of the measures are overlap, and there's 22 eCQMs that are not represented in MIPS CQMs, and there are 158 measures that are exclusive MIPS CQMs that are not available in the eCQM menu. eCQMs tend to be specific to an EHR. They typically require tight, rigid compliance with EHR improved documentation workflows, where, as I said earlier, MIPS CQMs can cast a broader net for any documentation style. Like everything, has a little difficulty pulling data out of text-only fields. Although an advantage with the MIPS CQMs is that you can take a list of your performance not met patients and abstract data from the chart that wasn't accessible electronically, and it's valid to update those to correct your submissions. Benchmarks used for scoring quality measures are different for eCQMs versus MIPS CQMs. When I say benchmarks in this context, you're scored on your quality submission by your decile rank or a little variation on percentile rank of all scorees. So it's graded on a curve. And the eCQM grading has an appearance of being more lenient than the MIPS CQMs. That is, at a given performance level, say 80%, your percentile rank in eCQMs will tend to be better than your percentile rank in MIPS CQMs. However, that's because eCQMs tend to undervalue performance. Again, if you're not right on the documentation requirement to hit the queries and hit the scoring, then your patient, even if they received perfect care, is downgraded to a performance not met status. So even though you'd appear perhaps to get a better score if you submit eCQMs, that's because you're probably not getting your full credit for your scoring, and you're likely to get that full credit, or you can engineer that full credit more readily into a MIPS CQM submission. So that's basically the difference. Again, any more clarification, happy to dig a little more deeply in. But thanks again, Liz, for that great question.